Akwa-Ibom State, Nigeria, a place of vibrant culture and natural beauty. But beneath this picturesque facade lies a silent crisis, one that affects the most vulnerable members of society, mothers and their children.
We've realized that a lot of people were suffering for as little as a 500 naira worth of medication because they could not pay transport money, transport fare from their community to the nearest health institution, which was some 10 kilometers away.
According to the National Agency for the Control of AIDS, NACA, Akwa-Ibom State accounts for the country's highest HIV prevalence, with 5.6% of the population affected. It also has the highest prevalence of HIV among pregnant women aged 15 to 24.
When they go for antenatal care, when they are tested or screened for HIV, whichever of them are test positive, they also take up PMTT services at the health centers.
Studies have shown that receiving antenatal care can significantly reduce morbidity and mortality rates for pregnant women. The World Health Organization recommends at least 8 antenatal care visits to ensure the best outcomes for both mothers and babies.
These women are dying from preventable causes. In Akwa-Ibom, the major causes are eclampsia, complications from abortion, and obstructed labor. And there are contributing factors to these causes, which are that the women don't go out for care, that is antenatal care. And because we know that when they go for antenatal care, complications are detected early and they are managed to bear safely.
In the face of these challenges, TY Danjuma Foundation, in partnership with Antorf Rural Resource Development Center, are embarking on a Healthy Mother, Healthy Child project that aims to improve maternal and child health care across the state.
Through TY Danjuma Foundation's funding, we're able to implement Healthy Mother, Healthy Child program in Akwa-Ibom State, and we've been achieving good results on the project.
For complete 3 months. So transport was so costly. So my transport. I'm been so much the transport so only things like more cars from the only where charge I don't carry charge, but everything soon on be getting fun. Small drugs, any kind of drugs, they give you for free. So till my baby don't go almost 7 months now. There's nothing. I am feel cute. My baby feel better.
So someone came and told me that TY Danjuma Foundation ARRDEC. KD gave me he made me same way I'm need up. So I just came. I saw pregnant people. There were many. So then they give and they just check on me, and anyone no more. So I came to register. They said I should register for antenatal. So I also register. My pregnant is 7 months pregnant. I'm okay. And no, when no pampers and no all those things, and I want to take care of my baby. They have given us multivitamin and we have not paid for anything. They have given us free antenatal, given us transport. They encourage us for our baby to be healthy. And me, I'm healthy. My baby is. I believe my baby is healthy. They have provided so many care for us, for baby.
All what they gave me is free. Right from when I give birth to my baby, I've been coming to health center. So I've been taking good care of me. My baby now is 4 months. I bring her for immunization for health center. Since I got pregnant, about 5 months, I've been here for antenatal, and they really take good care of me. And my pregnancy, everything was free of charge. And they really attend to me in very good and mindful way.
Over the next 5 years, The project will implement a comprehensive plan to achieve the goal through capacity-building initiatives, embark on mobile outreaches, create awareness to increase demand for antenatal care and prevention of mother-to-child transmission of HIV services.
Before now, infected mothers with HIV thought that it's not possible for their child to be negative of this dreaded disease. But through the effort of TY Danjuma Foundation, it has been proved that mothers that are reactive, their babies could turn out to be negative of this HIV.
Every mother, every child. Ikedi beneri nike Akwa-Ibom State. Ake mano sokedi ufok. Adi nkunye ni debe nyen kine ni sanga kayidi. Bomme mindi dari managin mano sori mbenye ne kri namin tes. Amin sanga mboy bode. Mboy bode gine mieru mindu. Ayeni deme songa gine mi songin. Adi namin tes. Kedi namin tes after 18 months. Ayen check nyene sanga nonye ni bo min sanga mboy bon ko bi nemesi. Agine mieru wo mindu wem.
Now we follow benefit from early mother and early child program. They came to my house. I said they get belly. Then I go to the hospital. The woman tests me and said that I have HIV. Then he tests me as he tests me. He said I should take pills. When I get to the belly, I so worried, feel bad. Say, this thing will enter my baby. I so worried. The thing that worrying me is very well. But as my baby come to born, the thing that they enter in body. I thank God so much for brought them come to the Akwa-Ibom.
The project will also strengthen 30 primary healthcare centers, ensuring they have the necessary resources and equipment to deliver effective maternal and child health services.
He also complained about the attitude of the workers, the healthcare workers. So with the project, TY Danjuma Foundation, the Other Mother Early Child Project, we'll be able to address these gaps. On the project, through community volunteers, we're able to mobilize pregnant women to go for antenatal care at the facilities. And we also partner with traditional birth attendants. We train them on universal precautions during birthing. And also we make a demand on them to refer the pregnant women that come to them to the facility for antenatal care because they cannot provide such.
Through this project, we have been able to send our community volunteers, go inside the villages, encourage all the pregnant women to access the facility for their antenatal care.
In terms of affordability, they are able to access the facility without any payment. They registered free of charge. The routine drugs were given to them for free of charge. And with that, it really increased the population, the client flow of the facility. Initially, we don't used to have much attendance during antenatal, but when they come, it like this one will go. When Mrs. A comes and everything is done for her without money, she will go and tell her friend. From there, the friend will link. A lot of them used to go to the TBS. They used to go to the churches to have their babies, to go for ANC. But with this project, a lot of them started coming.
The project will collaborate with other developmental sectors to organize events like the National Safe Motherhood Day, where free surgical services will be conducted for women in need. Media campaigns will raise awareness about the dangers of teenage pregnancy, and HIV testing services will be provided to women of childbearing age. The project will not only address the immediate health needs, but also empower community groups and structures to sustain the demand for antenatal care and prevention of mother-to-child transmission of HIV services in the long run. The expected outcomes are ambitious. Over 2,500 pregnant women will have access to at least 8 antenatal care visits, ensuring healthier pregnancies and safer deliveries. 95% of identified HIV-positive pregnant women will receive the support they need to prevent mother-to-child transmission of the virus.
Coming to the facility will be sure that all the pregnant women have been checked, several tests done. Most of them, if they are reactive clients, we make sure we place them on treatments and start them on drugs so that the mother and the baby will both come out healthy.
We also partner with the healthcare workers themselves, because another reason why they don't want to go for antenatal care or for care at the facility is because of the attitude of the healthcare workers. So to address that gap, we train the healthcare workers. To date, we've trained more than 100 healthcare workers across 14 LGS in Akwa-Ibom State, and we have achieved very good results. We've trained 83 TDs on the project to date.
There was a refresher training that was done, a 2-day refresher training that was done at the operational base. That training has really been of help to me. Labor cases, how the stages of labor, how to manage each stage, and the care of mother and baby, the pregnant woman, how you should care for the pregnant woman, how you should care for the newborn baby, and even the cord, to avoid the cord being infected and the baby having a problem.
Through the dedication of organizations like Antorf Rural Resource Development Center and the collective effort of the community, the journey towards improved maternal and child healthcare in Akwa-Ibom State is ongoing. It is a journey that holds the promise of brighter futures and healthier generations.
We started in 2019. Today we mobilized more than 8,000 women to attend antenatal care, which is not a common feat, because pregnant women don't traditionally go out for antenatal care at the grassroots level, and we've been able to mobilize them through the help of the community volunteers who engage on the projects and the traditional birth attendants they go to.
The program has been so impactful and helpful. In fact, it has really encouraged most women, because we give out Pampers, we support mothers, and this has really given us a huge turn-up of pregnant women coming to access the facility for their antenatal care.
We have a number of children who were given birth to by HIV-positive pregnant women that are already declared negative at 18 months. We have more than 36 children that were declared HIV negative. The pregnant women have been put to bed safely. This year alone, we have more than 160 births as the children have been given birth to safely. And we're really grateful for the results we're getting, because when we've exceeded a particular LG, when we go back, we still see that the results are resounding and lasting.
The training on that basic obstetric emergency care that was given to me has saved 3 children in my hands. And one of them is here. She put to bed, you see the baby was, as you see, is all dead. And I used that resuscitation kit that was given to me on her. This happened on Monday, this week Monday by 6. And that child come back to life, and she is the 3rd child that has come back to life.
I thank TY Danjuma Foundation and ARRDEC for everything they have done, free medication they have given to us, and I pray we should come back next time and do more.
TY Danjuma Foundation, God bless you. Thank you very much.
I want to say kudos to TY Danjuma and ARRDEC, and to encourage them to keep on this good work. Thank you very much, and God bless.